Some of these red flags, as far as in a medical exam, include things such as malnourishment or extremely poor health, or severe addiction to alcohol, as well as an addiction to some hard type of drug. However, the most obvious red flag of somebody who's in a trafficking or even just in a unjust situation are the signs of physical abuse. And in particular, when there's unexplained injuries and people are kind of panicking to explain what they think happened. And some of those are things that include bruises, black eyes, burns, cuts, broken bones, broken teeth, and multiple scars. And this is usually when people can't explain what's going on.
Human trafficking victims suffer from a wide range of physical and mental health effects. Typically, short-term effects are higher risk behavior such as alcohol and drug abuse. Impaired judgment is commonly noticed as well as emotional exhaustion, depersonalization, fear, and anxiety, and also nervousness. Long-term effects follow in a form similar to post-traumatic stress disorder. Symptoms are outbursts of anger, intense distress to cues that symbolize aspects of traumatic events, or also paranoia, fear, and severe depression. Other effects result in sexual dysfunction, feelings of being mentally broken down, and difficulty maintaining healthy relationships.
As a medical professional, if you suspect that your patient is a victim of human trafficking, here's information on how to conduct an exam with the potential victim. You should utilize any existing assessment and examination protocols for victims of abuse or sexual abuse that you are already aware of. You should use age-appropriate language if working with minors. If you ask about sexual history, be sure to distinguish between consensual experiences and non-consensual experiences. If possible, choose a comfortable space that's conducive for confidentiality. If appropriate, separate the individual from his or her belongings and escort the interpreter or the victim. The victim may be wearing or carrying some sort of tracking or communication device such as a GPS transmitter, cell phone, or other small device. You can separate the victim from these devices by getting him or her into a gown and into an X-ray room. If the individual is a female, approach should be made by a female staff member, whether a psychologist, physician, social worker, or female police officer that is not in uniform. If you think you have identified a victim of human trafficking, you should be sensitive to the patient. Every incident of human trafficking is different. Make sure you are not putting yourself or the individual in danger. Take care to notice who is around when you are asking questions or providing resources. If you suspect that the victim is in immediate danger, notify the police. Try to record as much information about the situation as possible, being careful not to put yourself or the individual in any danger. Present outreach cards and/or hotline numbers for local anti-trafficking service providers or other anti-trafficking hotlines to suspected victims. Give this information directly to the victim and only when he or she is alone. Provide the individual with NHTRC hotline number and encourage him or her to call if he or she needs help or would like to talk to someone. The National Human Trafficking Resource Center, NHTRC, is available at 1-888-373-7888.